I'm Diane Rowden with awesome Hernando County, and I'm sitting here with an awesome Dr. Joani Davis with Davis Family Hearing. How are you doing today, Joani?
Wonderful, thank you.
Well, Dr. Davis.
You can call me Joani, that's fine.
Well, we just interviewed, Amanda and George, and Amanda had cochlear implants.
Yes.
And maybe you would like to add on a little bit about her experience and what you've been through.
Absolutely. She had a very emotional journey, and when Amanda came to me, she had progressively started to lose her hearing at the age of 17, and it gradually got worse and worse until she was 100% relying on lip reading to communicate with people. She does not use sign language, so you can imagine how exhausting that would be to only be getting a little bit of sound and no actual clarity out of your hearing aids and have to concentrate solely on somebody's lips. Only 50% of speech sounds are actually visible on your lips, so she was having to fill in the gaps an awful lot. And she did a very good job of describing what it was like before she got her implants. She felt like she had to control the situation because if somebody switched topics, she was lost. She had to know exactly what the topic was. She said to me multiple times, she's a very intelligent human being, and she said to me multiple times, I'm tired of people thinking I'm less intelligent than I am. I'm tired of people thinking I'm stupid. I'm tired of people being rude to me because they think that I'm ignoring them when I'm not. I'm tired of my personality being perceived as something that it's not. Because you can tell she's a very lovable person and she loves to spread joy. She's actually become a huge advertisement for cochlear implants. Everybody she sees, she says, you need to get a cochlear implant. And actually, her brother is getting a cochlear implant on December 7th. It is a hereditary hearing loss, so she's converting her entire family as well. So when she first got the implant, the first day she came in to see me, she started crying as soon as we started talking about it. And she said, no, I don't want you to convince me to do it. I'm going to do it. But it's just a very emotional thing because you are going into surgery. And a lot of times your hearing itself, there's no residual hearing sometimes after you become implanted. So hearing aids aren't usable. So you're saying, I'm not going to wear a hearing aid anymore. I'm going to wear a cochlear implant. As soon as I turned it on, she could understand better. And George, her very supportive husband, was sitting there with her, and she could understand what he was saying at a normal level, which was incredible.
And I can't imagine how, we've seen on social media sometimes they'll have a Facebook of somebody who's had like a baby, actually a child, when the first time they've heard their mother, but you can't imagine with someone who's this age, who's been suffering for so long, and then all of a sudden it's like their whole world just probably opens up to them and their life. So, that's just, it is awesome and amazing. And I just want to thank you for your dedication to Hernando County residents here and throughout. I'm sure you do some work in Pasco, but we just want to say that you're here in Hernando County, and it's and Davis Family Hearing is an awesome business. And anybody that is watching this, and if they just would like to come in, I think you have a 30-day free trial. You want to say anything about that?
Absolutely. Any sort of hearing rehabilitation, my goal is to eliminate any barrier for someone to pursue better quality of life through better hearing. So we always offer a free 30-day trial on any product, so you get a chance to experiment before you make any sort of decision about whether or not you want to integrate it into your life.
Great. And you have a couple locations in Spring Hill. You're right here on Spring Hill Drive, where we are now, just just east of Linden.
Yes.
And you also are in Weeki Wachee, right off of Highway 50, down by Withlacoochee Electric.
Correct.
Okay, so, well, great. Would you like to add anything else, Dr. Davis?
The only thing I want to say is my patients tell me that the most difficult thing about treating hearing loss is getting to that first appointment. So once you get past that first appointment, it's fun after that.
Okay, great. All right, well, thank you very much. And it's going to be an awesome day in Hernando County. Thanks.
Absolutely. Thank you.
Hi, I'm Diane Rowden with awesome Hernando County, and today we're with Davis Family Hearing, and we have Dr. Davis with us, but right now I have Amanda and George. And Amanda, you have some amazing stories to tell us about your hearing, and actually your lack of hearing, but now because of what the treatment that you have received by Dr. Davis with cochlear implants, right? So what I'd like you to do, Amanda, is introduce yourself and your husband, George, and tell us a little bit about your life and how it's changed.
Oh, since my implants?
Yeah, go ahead.
It's too amazing to put into simple words because it was just, and I might cry. I wasn't thinking. With just my hearing aids, my life was pretty nice, but I don't know.
How about you, George?
Well, I think the thing, what Amanda's trying to say is we had grown, her hearing loss had degenerated to a point where the hearing aids weren't helping her anymore. And so we did a lot of research on the cochlear implants. And, there's always a little anxiety about it, but it was definitely the best thing we ever did. All Amanda says is she wishes she had done it, 5 or 10 years ago, because now her hearing's progressed to the point where when we come and we get, every week we come and it gets adjusted a little bit so her hearing gets better and more balanced. And it's gotten to the point where Amanda I got home from work one day and she said, "Can I ask you a question?" And I said, "Yeah." And she says, "Does grass make noise when you walk on it?" And I said, "Yeah, of course it does." And she goes, she hadn't heard that in 15 years. It's very little simple things that you notice that we don't listen to the sound of grass anymore or anything like that. And, it's seeing how much easier it is for my mom to talk to her. For our kids, they're not enunciating every word as much when they speak to her. So it's really a huge change for both of us.
That's amazing. And also, Amanda, I heard that you work for the post office.
Yes.
And before you weren't able to do routes because of your hearing problem, or you had some other changes in your work that allowed you to.
I think the difficult part was when customers are constantly asking you questions. I'm going away, I'm putting my mail on hold, or, how do I do this? I need to ship this. So it's a lot easier. You talked about that.
I would have customers running down the street
Trying to catch you.
to get my attention, and I would not, if my back was turned to you with just hearing aids, you could be full on screaming and I would not hear you. And so they would call, "Oh, my mail carrier just ignored me while she drove down the street." And of course my manager would say, "Well, she's deaf," and they would feel bad. But now I can hear, I'll drop off a package and somebody's saying, "Thank you." And now I hear them, they're not just think I'm ignoring them anymore. Music, I was a very musical person, and I really have not listened to anything in 15 years. And now I drive my own car for work. I don't have a mail truck, so I can plug in my phone, and my days I can listen to music all day long. Wow. Whereas before I was just in my head the entire day because there was nothing. Music would just sound blah, 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 blah. And now it's distinct. Your voice is distinct, where before I could tell you were talking, but I'd have to read your lips. And now, you notice I look at your eyes more. I still look down to your lips because that's habit. It's just indescribable to tell you the difference.
Well, I can, and I can see it in your face, Amanda, because, just the excitement and even you just thinking about it, again, brings tears to your eyes because it sounds like it's opened up a whole new world for you, because I know that, you know, I've talked to people before, and when they have difficult time hearing, it's just that people think that they're ignoring them or that they're rude, and, you know, so I'm sure you've gone through that, and now you know, it's just changing, and people have probably said that your whole face lights up, right?
It's more, I have more energy, because it's, unless you do it, to lip read all day is very, very exhausting, and you're having to control. That's it. This has allowed me to be who I am. I don't have to control the conversation anymore, so I can follow what you're saying. Because if you were to switch to another conversation, I would be lost. So I would control the conversation, and people were calling me bossy. And I might feel a little bossy, but I realize I have so much more energy because I can just let conversations go the way they're supposed to, as you would naturally, and follow along with it, with sometimes a little help still. Hopefully that will go away. I'm able to be who I was before I lost my hearing, because I'm not having to be in control of every aspect of everything.
That is amazing, and what a wonderful Christmas you're gonna have this year, right?
Turned on my birthday.
She had this turned on your birthday, and that was a week ago, right?
Yes.
So, well, happy birthday. What an exciting gift. So, would you like to say anything else, George?
Yeah, I mean, for somebody who's the spouse of a hearing impaired person, it's just changed our dynamic at home a lot. You know, it's a lot easier for, you know, it's got the kids on their guard, because now they can't mumble things under their breath. So they're you know, you see their faces when they mumble something as they're walking away, and Amanda will go, "What did you just say?" Whereas before they might be able to get away with it. So it's a lot of fun. There's a lot of I don't see any negative aspects to doing it. It's like Amanda said, we wish we would have done it a long time ago.
Well, I'm excited to see you and talk to you again in a couple months, because I'll bet you all even see a bigger difference since it's only been a week since you had the one turned on, right? So.
This one was turned on in June, and this one just a week. Yes. Yeah. And I'm told I'll see differences throughout the rest of my life.
Oh,
so yes,
I'm sure. And I tell you, you have a phenomenal doctor, Dr. Davis, and with Davis Hearing, and I know that again, your whole life is just going to be opening up, and you're so young. You've got such a great opportunity and young kids. So I just am amazed with what I've heard, and God bless both of you. Thank you.